In the spirit of reconciliation, we acknowledge the Gadigal and Bidjigal people of the Eora Nation, the traditional custodians of the land on which we record this podcast. We pay our respects to the elders past, present and future, and extend that respect to all Aboriginal and Torres Strait Islander people listening today. Do you have a chronic health condition and/or a disability? Or do you support someone living with a chronic health condition or disability? Hi, I'm Joel.
And I'm Lani, and we're Imperfectly Human. Welcome to Chronic Conundrums, a podcast from the Sydney Children's Hospitals Network, all about our chronically chaotic lives. In our journeys with a chronic condition, we must become expert navigators of the extraordinary, because every day presents a new challenge.
We're here to tell you what to gain from those aches and pains, because we're more than just patients, surgeries, and prescriptions. We're people too. To help us unravel the chronic conundrum of healthcare transition, we're privileged to be joined by Dr. Jane Ho, Medical Co-Lead of the Trapeze Service, a paediatrician at the Sydney Children's Hospital Network, Senior Lecturer at the University of Sydney, and who has a great recipe for festive salmon and so much more. Do you want to introduce yourself a bit more specifically than festive salmon?
Thanks so much, Joel and Lani. Yes, I'm a mother. I'm a parent of two teenagers, and I want to say that in my work at Trapeze and with transition, that it's not just me, that I work with a whole lot of outstanding people, and it's completely a group effort.
So thanks so much for being on the podcast. In your role as a staff specialist and a medical co-lead on the Trapeze team, how do you support young people in the move from paediatric to adult healthcare?
That's a really good question, Joel. Thanks for asking. And if I may, there are different parts to my response. So I'll start with sort of the individual point of view. I like to sort of see a young person and to do what we call the transition assessment. And we think of transition in like very broad ways. And I tend to split it up into sort of three areas that I like to know about for young people. And like the first is about their independence and self-management. And that's because young people are growing up. Usually, when we see them, it's about encouraging them to think for themselves. They're finding their identity. And sometimes it's hard when you have a chronic condition. Also, a lot of the young people, when we see them through the hospital system, they've tended to have their chronic disease or condition from a really early age. And so there's that influence of their parents being involved, their parents being very key to their management. So it's a little bit about negotiating how do we optimize and strengthen that young person's ability to look after themselves because this is their life, but not taking away at all from the parents' role, but just rebalancing so that young people can be strong, because all of these changes occur at a time when young people are probably going to be more independent where possible, leaving home, spending times with their friends. And so how do we navigate that type of support? The second area that I like to sort of think about for, transition is very practical and sort of very much about logistics, and that is the transfer to adult health. And what that means is thinking about the young person and what chronic conditions are they living with? How does it affect their life? But also how many teams and who are the teams and doctors or, healthcare professionals involved in their care? So at the start, of course, it's the GP because that's their primary care. GPs are amazing because they can be involved at all ages in life. And there's a term these days that's sort of getting popular. It should be their medical home. So it's like the first person you go to if something's going on. But apart from that, thinking about in the children's hospital system or the paediatric setting, who are the different teams? So there might be a general paediatrician, but sometimes people are pretty complicated. So they might have 10 different, teams involved. Gastroenterologist, neurologist, rehab team, cardiologist, like so many different ones. And so the thing with children's healthcare, where we are based in New South Wales and at the Children's Hospital in Sydney, is that the Children's Hospital services are statewide. It doesn't matter where anybody lives. We take everybody. However, when you change to adult healthcare, the system is different, and adult healthcare is about close to home and within your local health district. So, for example, if you live in Randwick, where we're talking now from Sydney Children's Hospital, Randwick, the area is part of Southeast Sydney Local Health District. So the idea is that adults who need to go to hospital go to hospitals within this area. And in each local health district, there will be smaller hospitals, and then there'll be like a tertiary referral hospital for that area. Okay. And so we need to think about, well, all of the services that young person is getting right now from the Children's Hospital, is that all possible close to home at their local hospital? If it's not, then do we need to think about linking them to their tertiary hospital, the big hospital in their area? And if that's not available, where should their care go? Because sometimes in New South Wales, there's only like one clinic or two clinics where, where there is the expertise and the staff who can look after people. So it can be either simple or it can be a little bit complicated. And the levels of complication sort of go up if you're from the country, if there are other things such as English is not your first language, or, for our, Aboriginal families, there's just layers of vulnerability that sometimes require even more care and coordination and support.
Sure.
The third area, so only three, so this is the last area, is psychosocial transition. So it's about all these areas in all of our lives that are really important to us and who we are and how we live our life, that also have an impact on our health care and our health. So what I'm talking about is things like what's happening at home, what's happening at school, what's happening when people leave school, because this is also a time of transition, what happens financially, and is there a role for Centrelink, which is our national welfare support service? Is there a role for support from Centrelink, either financially or through mechanisms such as a healthcare card? But also, at this age for adolescents and young adults, it's the influence of the peers and friends. Is that healthy? How about in terms of managing stress, anxiety and mood, eating, sleeping, exercise? All of these things keep us well and also have an impact on our health care. So we talk about that. And for some people, we also talk about decision making and sort of whether we have capacity or not to do it, because there are some legal things that may come into consideration for people who need that support around decisions. So that's for the individual care. In transition, we know that there are a lot of challenges, and a lot of those challenges are not because we don't have enough doctors or health teams who are interested in giving good quality care to young people. That exists no matter whether you're paediatric or adult. I think a lot of the problems are from systems challenges to do with how the resourcing and models of care are different between the paediatric and the adult health services. And so some of the work that we do at Trapeze is looking at these systems. So, for example, within the Children's Hospital system, we work with other specialty teams to really encourage, instead of like outpatient clinics that are 0 to 18 and all ages, we try to encourage people to hold adolescent clinics so that the type of care that the team gives for that clinic is more like developmentally appropriate and works on really encouraging young people to step up and to start having those conversations directly with their teams, for example, instead of parents stepping in and doing all of that conversation. So once you have like things like these adolescent clinics or transition clinics, we can add in different things as well to support transition, such as inviting adult teams in that specialty to come and have like a co-clinic where there's both paediatricians and adults. And so for individual young people and their families, it's a nice introduction, a gentler introduction to getting to know the adult team. Also, like within the state in New South Wales, looking at all the things outside of the Children's Hospital, we have this very good government stream called Agency for Clinical Innovation, Transition Care Network. The job of that is to work with local health districts in bringing good models of care and thinking about policies and services through the state and in different local health districts to support young people and also transition. At the moment, I'm co-chair of that, so that there's also, again, talking about systems and change, trying to change things that are outside of individual clinicians or individual care. Okay, so that's the second area, but also there are other areas that we can make a difference in terms of transition. So general education and having information available to people. Things like, why is a GP important? Things like, what is the financial situation for managing healthcare? How does that work? How does Medicare work? Things like about local health districts and how about adult, care being close to home. So we have a lot of information that we share to get them developed together with ACI. That's available on our and ACI's website. We also run webinars every 2 months, just talking about general transition information, and everybody is welcome to attend those. Another last area that I'd say is important when it comes to supporting transition is research. How do we know what works and what doesn't?
Transition requires an enormous amount of collaborative work. So how do you establish and sustain productive communication across a young person's medical teams? And what do you think are the best qualities for a clinician that they can bring to their practice?
Yeah, communication is really the key. Working with all of the teams directly involved in that young person's clinical care. It has to be collaborative, and we have to talk or communicate in different ways. Let's see, best qualities for communicating with young people. I think respect is probably right up there. Why is it important? Because young people are responsible for themselves. It's their lives. It's their determination. They're the ones who can give consent to things. So, of course, every clinician, every person who works in healthcare really has to respect that. And sometimes decision-making and truly giving informed consent is not about the health team saying you need to do it this way. It's actually listening to the young person. And if there's disagreement, then it's about both people being open to each other's perspectives. And the important thing is that people can come together to agree on something going forward. So respect sort of underpins all of that. So it's important that there's enough time for everybody to say their piece and for there to be discussion and for there to be a plan.
Adult care services require young people to be accountable and advocate for their own healthcare and health needs. But before this, most young people are accompanied by parents or carers to essentially every appointment. It's hard to not continue to rely on their support most of the time. So with that being said, from your perspective, what does responsible self-management of a chronic illness look like to you?
I think as a start, having good knowledge and understanding of, your chronic condition and how do you look after yourself, and having that knowledge of who is involved in your healthcare. So I'm talking about the names of your health teams. How do you contact them? If you need to get a message to them, how do you do it? Okay, so that's a start. I think being able to, have those that insight and judgment about, when you're feeling sick, when things are not optimal. How do you spot? How do you flag when it goes, I'm on my way down, or things are not as good as I'd like? And then is there that ability to maybe have a plan to go, okay, I'm going to step up to the next level of care that my body needs? Or is it, when is it the time to actually contact your health team and go, hey, I need help? Okay. So I think that ability to judge where you are at and the ability to ask for help is really important in self-management. I guess, there are things like the daily care, the daily routine of treatment. That's easy to talk about, but hard to do because we all lead busy lives. But it is about, if you need to take a medication 3 times a day, are you actually taking it? Do you know how to get a prescription? Do you go to the chemist to fill the prescription? All of these very daily things like that. So that could be speaking directly to young people, could be having 5 minutes on their own without their parents in the room. And it's not about having parents and family carers completely out of the picture, because no man is an island and we all need to rely on family and friends for help at specific times, even for those who are very capable. And, those times would be maybe when we're sick, when we're physically sick, or maybe the times when we're actually feeling stressed, or there's a lot of other things happening. The other thing I'd say about self-management is that we have to think about where young people are at in terms of their developmental maturity and their intellectual capacity. So I think to take those considerations into account and say if it's developmental maturity, then there are conversations, there are things to do to support young people so that they're feeling confident to make decisions on their own, but also that they're confident to ask for help and to mull over a question with their parent or their health team. There are a proportion of people in our community who lack intellectual capacity to give informed consent and to make decisions on their own. So in those cases, and it's not always a black and white thing, there are different levels of capacity. It's thinking about, well, how do their wishes remain, in place for as much as we can, and who can be in the position to help that young person either make decisions on their behalf or to work with them.
Those were some thoughtful insights into healthcare transition. We appreciate your clinical perspective, Dr. Jane. Our next episode marks our rise to the summit to see the horizon, the adult world. With a very special guest, we'll explore the possibilities of newfound autonomy and aspirations, because the sky's the limit. For now, this is Joel and Lani signing off, and we promise next time you'll hear from us, we'll still be chronically ill. While we strive to support you on your journeys with a chronic condition, this podcast is not intended to be a substitute for professional mental health advice. If you find any topics potentially triggering, please seek help from a local mental health professional or contact Kids Helpline on 1-800-55-1800 for 24-hour advice.